Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. And who's gonna make me a big star?
You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe.
So are there times when you would not prescribe physical therapy? In reference to a car, let's talk about a car wreck.
Right. Yes and no. It's rare. But there are some high-performance athletes, Pilates trainers, people who are very attuned to their body. There usually isn't much that therapy can do other than doing that kind of nerve stretching, which if you go to a YouTube, you'll often see that as nerve flossing, like dental flossing, but nerve flossing or nerve glides. And that's, again, something that a person can't do with their back and hip very well or their arm and shoulder. That's where physical therapy can be very helpful. People who are sometimes just very stiff, once again, can't really restore the motion as well as a therapist could. So to answer your question, unless it's a fresh accident, and I don't see fresh accidents, they're usually 2 to 3 months down the road, I would prescribe therapy if they haven't had it. But again, also, many people can't do the therapy until the swelling is down. And sometimes the swelling doesn't go down until you take a medicine like meloxicam or Celebrex. So I put them on that medicine for 2 or 3 weeks, which is usually what the time it takes to get insurance approval for the physical therapy and then do it.
So you talked about swelling. Can you see the swelling on like an MRI, X-ray? What kind of imaging can you see the swelling on?
A lot of it depends on the person. So to answer your question, I can feel the swelling by examining somebody. Just because after 30 years and doing this for thousands of times, you begin to appreciate the amount of resistance or what we call turgor that the tissues can have. And so I do that by physical exam. X-ray occasionally will show swelling if they're very swollen. MRI otherwise is the best test to look for swelling, but there you have to time it correctly because nobody swells for at least 48 hours, and it probably doesn't really maximize to 7 to 10 days, except in situations like pinched nerves where the swelling can sometimes go on for months because whatever's pinching the nerve persists, and therefore the swelling persists. So I know that's one of the issues that sometimes comes up. Well, somebody gets an MRI a day after or the day of their injury, and it doesn't show much. In part, that's because you get taken to the emergency room. The emergency room's there to make sure there isn't something catastrophic going on. So they go ahead and do a scan, and it's normal or it doesn't show anything. And that's quite often very true. That doesn't mean they aren't injured. So just kind of as a rule of thumb, in general in orthopedics, we usually re-X-ray at 2 weeks because there are hairline cracks that occur in bones that aren't visible for 2 weeks. And then for the MRIs, same thing, 2 to 6 weeks later, we'll do the MRIs to let the tissues adapt to it. Because at the end of the day, different than a physical exam, at the end of the day, an MRI or a CAT scan is really just a photograph. And so that photograph inside the body doesn't really change until the body's had a chance to react to it. A little bit different than doing a physical exam where you can actually usually feel things right away or touch certain nerve bundles or muscles in a way that wouldn't normally hurt unless that nerve was inflamed.
So if I came to you 24 hours after an accident, and I was having pain, like pain in my leg, pain in my back, maybe something in my neck, maybe one leg. I don't know. Doesn't it just shoot in one leg usually?
80% of the time it's one leg, but it can be on both sides.
Could you feel any kind of issues with swelling at that point?
Possibly. The problem we get into is low backs are a bigger body part. So it's really difficult to feel the swelling in low back. And particularly if you're carrying a few extra pounds, it gets difficult to distinguish between swelling from an accident and just some what we'll call fluff. Neck's a little bit different because it doesn't tend to have the deposits of fat in it. And so usually just probing right underneath the skin, one can feel the swelling. But at the end of the day, we use MRIs and CAT scans to plan treatment. And unless there's a neurologic injury resulting in hand weakness or foot drop or the leg not working, the treatment for the first 2 to 3 weeks is going to be rest, bracing, anti-inflammatories. So an MRI or CAT scan that quick really doesn't change the treatment plan, and also has the problem that it may not show everything because the body hasn't had a chance to react. So really, no, wouldn't order it in the first couple of weeks. As a rule of thumb, it's usually 6 weeks before we do any of that.
So if my accident that I had, 10 miles an hour, had those issues, what would that treatment look like if I was having those pains?
Assuming your arms are working and your legs are working, it would really be that soft neck brace, the anti-inflammatories, no bending, lifting, pushing, pulling, don't do any yard work, don't do any overhead work. Try not to lift from the floor for about the first 4 to 6 weeks. And I would ask to see you back at that time if you're still having trouble. And again, the vast majority of problems go away by that time.
So what about injections? I hear a lot of talk and I see a lot of things about steroid injections.
Steroid injections, very controversial. The purpose of a steroid injection is to relieve pain, but the purpose of pain relief is to make exercise more effective. So at the end of the day, this is an industry secret. Medications, injections, surgery are all done to restore movement and to restore function, because we humans are meant to move. And as long as we're moving, in general, we self-lubricate, we heal ourselves, and our pain naturally reduces. So surgeries, anti-inflammatories, injections are meant to restore the movement so that, as we were discussing, you can have nerve flossing. The problem is sometimes injections get overused purely to relieve pain without the component of the physical therapy, which requires a patient to actively participate, go to physical therapy, and then take their homework and go home and do those same exercises repetitiously to get the neck moving, to get the low back moving, to get the arching, to get the arm moving at all. So injections are a tool to restore movement and relieve pain so that the body can heal. But again, they can, like anything else, be overused.
So is it a temporary fix?
Many times it is, but it is temporary. It is not a solution to the problem. As patients tell me, they thought the injection worked, but it was really just a Band-Aid. So they don't want to do it again sometimes. Sometimes it works great, particularly if a person has a little bit of nerve pinching and are doing the therapy, but they can only move their legs so far or can only sit so long, or they have a hip that is out of place. An injection can loosen that up, get them over the hump, and then they're going again, and then they're moving. The other reason injections are used, just like the last patient I saw, too old to have surgical treatment. She has a problem where the nerve is very pinched, and she will probably lose her hand function because of that, or half of it. But the flip side of it is her age and health is such that going through a surgery might very well leave her badly stroked or dead. So we will do injections there for as long as she can tolerate them until they don't work, because it's really about the only form of treatment that's going to work on her, because she's already done the therapy, the bracing, and those other kinds of things.
So what about, do you have to go under for those?
You don't have to go under for those, no. Many people like to, because they don't like the thought of having a needle put in their neck or back or hip. Sometimes there are medical reasons where people do need to go under for the neck injection, but it's pretty rare to need that for the hip or the back, although many people would like to, again, because of needle phobia. And I'm speaking from experience because I've had my share of hip injections, my share of back injections, and they do hurt, but then it's over.
So again, working in the insurance industry, I've heard stuff about ablations. Can you kind of explain those, or if you do them with the back or the neck, or?
Ablations are another tool in the toolbox, just like an epidural injection. Epidural just means on top of the nerve. So if we are having major nerve pain, pain from the major nerves, the spinal cord nerves, that's when epidurals use. Ablations are used on the surface of the spine to relieve what we would consider minor pain or minor nerve pain from the surface, not the major electrical system, but the ones along the surface that are particularly noticeable when a person is leaning back or when a person is twisting. That's also something that is controversial because they are temporary. It's not a permanent solution. The nerve is deadened either with heat or by injecting alcohol or other substances that make the nerve just far less sensitive. It's something that in my practice, I will order one a month.
Okay. And you do those yourself?
No, I have a pain management doctor. I used to
Okay.
do them, but just the mechanics of it and insurance and all, in order to make it work, you need to do a half dozen or 10 a day. And I don't have that much volume or that much need for it.
And do you do the injections yourself, or do you?
Not any longer. Used to, same thing, refer them out, but at one time I did them. I'm supposed to be interviewing you.
Sorry.
You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe.
Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. The movie's gonna make me a big star, 'cause I can play the part